I've had problems on and off since birth, with no diagnosis until just the beginning of this year. I had a lot of problems with my stomach, maintaining my weight, and that's always been the biggest symptom, the biggest problem. I also had problems with dislocating knees and fingers and shoulders, and that kind of didn't seem to fit in with the stomach problems. And in the last sort of 10 years, I've been really bad, and a lot more pain, and I've had to stop working, and it has restricted my abilities to be independent and to do things that I like doing. But it has been a long wait for the diagnosis. Eventually diagnosed with Ehlers-Danlos syndrome. GP referred Mum to assess for help because of how my health problems were affecting her. She was having to get up in the night to sort things out with me, maybe 3 or 4 times, and I need a lot of help during the day as well. Social services did various assessments and decided that I would be entitled to 6 hours help per week. So that went out to a care agency, and they supplied the carers. But I found it quite restricting because I was told what time someone would be here, and I didn't have any say in that, and sometimes they were late by an hour or 2 hours. I wouldn't know who was arriving until I opened the front door, and that could be someone I'd seen a lot of, or it could be someone completely new who didn't know anything about me or my situation. I didn't like having someone with me in their care uniform when I'm out and about. I think it made me look more dependent than I currently am, and I feel it made me stand out a lot more. So I didn't like that side of things, but I knew that that was their role, that's what the agency insisted on. So my health declined quite a lot, and it became apparent that a social services carer couldn't do what I needed doing. Social services sent me on to continuing healthcare, and it moved fairly quickly from that point on. Because of my health problems, it was deemed that I needed someone else to be able to provide my care, and Continuing Health came out, did a very thorough report. Once I was eligible for continuing care, a more thorough package of help was put in place, and initially that was given to me through an agency. It became apparent that I was still having similar problems with the agency, so not knowing who was going to turn up when, and not having the chance to build up a relationship with anybody, and it just wasn't working. So my healthcare manager at the time suggested to me I look into a personal health budget, and that was the first I'd heard of it. She explained it to me really, really clearly, and went through how it could work. When I was awarded the care package through Continuing Healthcare, I then had to decide how to use it. The hours that I eventually decided on with the help of Age UK were just perfect for me. I was allowed to choose what I wanted, where and when, and it was a very sort of individual, very personalised process, and that was incredibly helpful. I employed 2 carers who I'd known previously. I was able to pay for them to go on courses, so they all were trained in first aid, obviously, but these 2 were trained specifically in how to set up and use a feeding pump, and how to draw up and administer medication overnight. I was asked if I would like to control that money or if I would like somebody else to do it for me, and I chose to have it done for me. It's something I didn't really want to do, didn't really need the extra hassle. We just email a copy of the timesheet that the carers have each done in a 1 month period, and email that off to A4E, and it ends up in their bank account within sort of the week really, and it's worked really well. It's so easy using A4E. They do everything for me. They sort out the tax and the insurance, do all the payroll things, all the bank transfers, and it just really suits me just having to send one email per month and then to know that everything is done. I wanted to make sure that there was some flexibility in the plan, and that the carers could have time off for important things. In fact, I gave Gail the day off. She actually worked it later on in the week because it was her little one's birthday and she wanted to bake the cake and sort out the party and all that sort of thing. And I felt that that was more important for her at that time than helping me doing the shopping. There was a 3-week hospital stay I had, so obviously the carers weren't able to work at all, but the package had the flexibility in it to be able to pay them a 75% retainer for all that time that I'm away, and obviously that makes a huge difference to them. Because I have control of the budget, it means that I can sort out what hours I want to work, and I have my 4 overnights, but I then have a few hours left, and with that I go to rock choir. The carer comes to the house and drives me over there, gets my wheelchair in and out of the car, helps me get into the building, helps me get into the right places and being at the right time, and also she administers medication when I need it, so that I don't have to leave the group to do that myself. She will administer medication for me so that I am always part of the group, and that's been great. It's been a real confidence boost, really enjoying it, and I couldn't have done it on my own. When I do go to rock choir, the carer who's with me isn't in any sort of uniform, same as me, she's just wearing jeans at the top, and it doesn't make me stand out so much as it does if I had a carer in uniform, and it just looks like we're friends and she happens to be helping me a bit. I've enjoyed the control over the hours and when they're worked and how, and it has been a really flexible system in terms of me having time off as well as them having time off. I think that's as important as anything. Having the personal health budget has been life-changing, and I can't recommend it strongly enough to everyone else. Definitely go for it.